to see about the anastomosis around the elbow joint. So, in this video, we are going to see about the arteries and its branches which is involved in this anastomosis. So, the arteries which involves in the anastomosis are brachial artery, radial artery, and ulnar artery. Brachial artery is the continuation of the axillary artery, whereas the radial artery and ulnar artery are the terminal branches of the brachial artery. So the branches of these three arteries are involved in the anastomosis around the elbow joint. So this is the anastomosis of the elbow joint. So first, the main arteries are brachial artery, radial artery, ulnar artery, and these are the branches from the brachial artery. These are the branches of the radial and ulnar artery. These forms the anastomosis around the elbow joint. So now we are going to see about what are the branches involved in this. So as we know, it is the lateral epicondyle and medial epicondyle. So one anastomosis is taking place in front of the lateral epicondyle and one at the posterior side, at the back of the lateral epicondyle, as well as in the medial epicondyle, one anastomosis is taking place at the back of it, whereas one anastomosis is taking place at the front of it. So now we are going to see these anastomosis. So in medial epicondyle, in front, inferior ulnar collateral artery. So inferior ulnar collateral artery is a branch from the brachial artery. So from brachial artery, inferior ulnar collateral artery, anastomosis with the anterior ulnar recurrent artery. So this is the branch of ulnar artery. So first anastomosis in the medial epicondyle, that too in front, is the inferior ulnar collateral artery, anastomosis with the anterior ulnar recurrent artery. So this inferior ulnar collateral artery is a branch of brachial artery. Anterior ulnar recurrent artery is a branch of ulnar artery. Then in the back or behind the medial epicondyle, this is the in front. So in back, the superior ulnar collateral artery, anastomosis with the posterior ulnar recurrent artery. So this is the branch of brachial artery. So this is the branch of ulnar artery. So now we are going to see the branches of brachial artery which involves in the anastomosis, and the radial artery, ulnar artery, and its branches. So in brachial artery, as we know, in the front of the medial epicondyle, superior collateral ulnar artery, anastomosis with the anterior ulnar recurrent artery. As the posterior side, superior ulnar collateral artery, anastomosis with the anterior ulnar recurrent artery, posterior ulnar recurrent artery. So this is the anastomosis taking place in the medial epicondyle. So superior ulnar collateral artery and inferior ulnar collateral artery is a branch of brachial artery, whereas this posterior ulnar recurrent artery, anterior ulnar recurrent artery is a branch of ulnar artery. This is the anastomosis taking place in the medial epicondyle. And then in the lateral epicondyle, the anastomosis taking place in the lateral epicondyle is in the front anterior descending branch, which is a branch of radial collateral artery, which is a further branch of profunda brachii artery. So this anterior descending branch, anastomosis with the radial recurrent artery, which is a branch of radial artery. And then at the posterior side, the posterior descending branch, anastomosis with the intraosseous recurrent artery. So this posterior descending artery is a branch of middle collateral artery. Further, it's a branch of profunda brachii artery. So and then this intraosseous recurrent artery is a branch of posterior interosseous artery. This posterior interosseous artery is a branch of common interosseous artery. Again, it's a branch of ulnar artery. So, these are the anastomosis taking place in the lateral epicondyle of the humerus bone. So, these are the anastomosis taking place in the around the elbow joint. See, in the lateral epicondyle, in front anterior descending branch, radial recurrent artery. This anastomosis, and the behind at the back posterior descending branch, anastomosis with the interosseous recurrent artery. So this interosseous recurrent artery is a branch of posterior interosseous artery. Posterior interosseous artery is a branch of common interosseous artery, which is a branch of ulnar artery. So these are the anastomosis taking place at the lateral epicondyle. Thank you.